American Society of Breast Diseases is unique in that it's deliberately multidisciplinary. So we have people from all different specialties, including support specialties. And for instance, we just heard Barbara Rabinowitz, the past president, talk about sexuality issues in women after they've had breast cancer. So it's one of the unique forums for getting the whole range of discussions about women with breast cancer. And so it's unique in that way, in bringing all the different specialties together to talk about some of the issues with women with this common and psychologically traumatic disease. Not as much physically traumatic anymore because of the onset of breast conservation and sentinel node biopsy, but certainly just the word cancer sends women, as you might expect, into a tizzy, so it can certainly help. Our discussions can certainly help with all the other aspects of breast cancer. Well, most societies, whether it's dealing with breast cancer or other illnesses, are sort of unifocal surgical approach to breast disease, or the medical oncologists have meetings devoted to medical oncology, but very few societies are deliberately encompassing all the specialists that deal with the women with breast cancer. So it's sort of a unique forum that way, and has been since its inception. So it's encouraging to have that kind of a group to really address all the issues. Because the breast cancer patients, uniquely, because of all the publicity about it, really need a multidisciplinary approach to it. And as a matter of fact, the multidisciplinary clinic in breast cancer is really the model for all the multidisciplinary clinics that have gone on since. I remember that one of the people that was contributed to a book we did a long time ago, talked about disease management is the future, breast cancer is the model. And that disease management is the new way to approach things, whether it's diabetes or hypertension or kidney failure or breast cancer or colorectal cancer or lung cancer or whatever. The idea of getting people together, because all these diseases have to merge special interests in order to get the best results. So breast cancer has really been a model for that type of approach. Breast cancer sort of lent itself to developing that model, partly because there were so many changes in the presentation of the disease, which allowed breast conservation, which when I was in training wasn't even considered. And there have been enormous changes in not only that kind of approach about breast conservation, but enormous successes in terms of managing the radiotherapy so it wasn't so morbid and toxic, managing the chemotherapy, which turned out to be very successful in terms of improving survival, but also because breast cancer uniquely was one of the first in cancer, one of the early examples of the success of screening. And mammography screening has made such a difference in the disease presentation that it's forced us to have a multidisciplinary model. When I was in training, there was only one thing you could do, which was a mastectomy. Even before that, a radical mastectomy. There weren't any drugs, and the radiotherapy was much less utilized. So there weren't many things you could do, so it didn't require multidisciplinary management. But as new things came on board for treatment, partly as a result of the improving presentation of the disease from screening, but partly because of all the research around systemic therapy, that breast cancer became the model for how you could handle these diseases in a multidisciplinary, integrated way.